The stockings are part of a concerted effort to protect you from a well-known complication of surgery. What we know from lots of other patients is that when you have surgery, when you lie down, when we make a cut in the abdomen and damage tissue, clotting factors are released that may inappropriately cause clots to form in the legs. And they form in the legs because of something that is an error in the normal miraculous process of your blood clotting system. If you think about it, the blood clotting system is just an amazing, miraculous system. Right now, every bit of blood in your body is as liquid as water. And it has to be so your heart can pump it. If it were to thicken up and get like toothpaste, you would die instantly. So we need that blood to be perfectly liquid, and it is. Right now as we sit here, perfectly liquid, and the pump of your heart is working well. It's delivering oxygen and working like clockwork right this minute. On the other hand, if, God forbid, you were to fall and scrape your knee or cut yourself shaving or, say, have surgery, your blood almost instantaneously realizes it needs to transfer from liquid to solid and clot. And we rely on that at surgery, and again, miraculously, it takes care of that without much thought. Now, that system is, as I say, miraculous, wonderful, terrific. It's not perfect. So sometimes we know, especially in a heavy person, especially with large veins, especially in somebody who's not as active as, say, a runner who runs every day, somebody who may have been sitting or in a bed for a while, the clotting system can get confused. And instead of remaining liquid in the veins in your legs or in the pelvis, it can turn solid and clot. And if it does turn solid and clot, it can cause problems. But the most dangerous problem is when it breaks free of the clot it formed in the legs and goes to the heart and the lungs. And there, it's called a pulmonary embolus. That's a lung clot that's moved, a pulmonary embolus, and that can be lethal. Now, in our series of patients, of 4,000 patients, we've had 3 clots in 10 years and 4,000 people, and they were all mild. There were none serious. And so we're pretty relaxed about it, and we think there's a good reason for that. Number one, because most of you are sitting up and walking and moving right till the surgery. The surgery itself is very short, and the surgery causes very little trauma or damage. So it doesn't activate the clotting system very much. If, for example, you would have a car wreck or crush the bone in your leg with a lot of muscle damage, the clotting system gets activated, those clotting factors get activated in the bloodstream, and so there's more chance for clotting. Okay. Now we do other things to help protect against clotting. We use a little bit of elastic stockings, and that helps slightly. We put on some air boots that constantly inflate and deflate, and they help protect against clotting. And we also give you a touch of blood thinner. And the touch of blood thinner has a risk of causing more bleeding, but when we balance everything out, we think a tiny bit of risk of bleeding is helpful against a little bit of protection for clotting. It's something we take very seriously. We have a track record which demonstrates that our short, simple surgery with early walking soon after the surgery helps protect you from clots. So although it's very uncommon, we still take it seriously.